Hi, are you a parent with a child that has special needs? Or maybe your child is a picky eater. Well, if that is the case, then this is going to be the perfect video for you. Because in this video, I am going to be sharing with you a list of items that you should have in your home in case of a natural disaster. Before we get into the video, I know a lot of times when we're prepping, we're getting our canned goods, we're getting our batteries, our flashlights, things like that. But have you ever stopped and wondered, amongst all the chaos, what can I provide my child to keep them calm? Okay. Essential oils, lavender, frankincense. Those are some things that can create an atmosphere of relaxation and also reduce anxiety. Now, if you have a picky eater, these are some other things that you should consider. According to the recent CDC data, around 49% of children do not eat daily vegetables, and 32% do not eat a daily fruit. So that brings us to the second thing that you should have in your home, pantry, or bug out bag. And that is osmotic laxative or even castor oil and or enemas. That is important to have, especially if your child is a picky eater. Maybe you can't go to the doctor. Now, as far as the dosage and everything, that is something that you should contact your doctor about ahead of time and ask questions. Is this okay to give my child? What is the dosage that I should give? Or even look up self-help videos on how to give your child an enema. Because as we know, when you don't have fiber going into your body, that can cause a problem with constipation. And a lot of times we don't realize why our children are acting out. Well, some of the time it is because your child is constipated. And constipation can cause all types of behavior issues. It can cause your child to start self-harming, just behaviors that are just, you don't even know why they're acting out. Well, constipation could be a reason why they are acting out because their bowels aren't moving through their intestines. So that is a must, I believe, that you should have in your pantry or your bug out bag would be one of the three things. The castor oil, enema, stool softener are important to have. And make sure you consult your child's pediatrician before dosing your child. Okay, so now I've written down a couple of natural things. If you don't want to do the castor oil or the enema, here are some natural things that you can do, such as prune juice. Prune juice is really good that you can give your child. You can mix it with a little apple juice, and that'll help stimulate bowel movement. Another thing would be physical activity, walking. That helps to get things moving inside of the bowels as well. And if you have a child like my son, he doesn't walk. I don't know if you guys remember, there was, this thing that we did with their legs, like they were riding a bicycle, and you just push their legs around so that they can move. Their bowels can move. So exercise activity, physical activity is good. And another thing, make sure that they are drinking water. Make sure that they're getting fluids inside of their body to prevent dehydration. And let's see. Another thing is you can gently massage the lower abdomen of your child to help stimulate a bowel movement. You can also give them a warm towel. You can place a warm towel on the top of their stomach to help stimulate a bowel movement. Lastly, I think this is really important. My son eats veggie patties, so he's been stuck on veggie patties for the longest. I just recently started making our own veggie patties because if we can't get to the store, how is he going to eat? So I started making veggie patties with beans and oysters, with a little bit of planko and cilantro and spinach, and mixing those all up together so that in case of emergency we can't get to the store, we have alternative foods that he will eat. So it's very important to try to introduce your children to other foods. So if you like this video, give me a thumbs up, and thanks for watching.